Hello, everyone, and welcome to our second module on anticonvulsants. Okay, let's start by talking about ethosuximide, which is an anticonvulsant drug that blocks T-type calcium channels found in neurons in the thalamus. And the thing you always want to remember about this anticonvulsant drug is that it's the drug of choice for treatment of childhood absent seizures, which I talk about in detail in the video on seizures. In terms of side effects, ethosuximide is associated with Stevens-Johnson syndrome, which is a serious skin reaction that many other anticonvulsants are also associated with. And then beyond this, it has some of these side effects listed here, non-specific things like nausea and vomiting. It can disrupt sleep for children who have to take this drug. And some children become fatigued on this drug while others get stimulated and can become more hyperactive. Okay, next what I'm going to do is talk about a couple of anticonvulsants that work through the GABA receptors. So let's talk about the GABA receptor in general for a second here. So GABA stands for gamma aminobutyric acid, and it's a neurotransmitter that binds to its receptor found on postsynaptic neurons of the central nervous system. And when it binds to its receptor, it opens a chloride channel. This causes a chloride influx into postsynaptic neurons, and this leads to neuronal inhibition. And so because of this mechanism right here, GABA is the primary inhibitory neurotransmitter of the central nervous system. You can find GABA receptors throughout the CNS, in the brain, and the spinal cord. And anytime there's more activity of the GABA receptor, you get sedation and anesthesia. And one of the things this can do is suppress seizure activity. And so this is a cartoon depicting the GABA receptor. You can see that it's made up of multiple subunits surrounding a chloride channel where chloride can enter the neuron. And so on some of the subunits, that's where GABA binds. There are other subunits where some of the drugs we'll talk about in a minute bind, like barbiturates and benzodiazepines. So all these drugs like benzos and barbiturates, plus the neurotransmitter GABA itself, they all bind to this receptor and they modify the amount of chloride going into neurons, and that leads to an inhibitory effect, which can be beneficial in seizure disorders. Okay, our first GABA drugs we'll talk about are the barbiturates. There are two drugs worth knowing about in this class, phenobarbital and pentobarbital. They both bind to the GABA receptor. They bind to one of the subunits of the receptor. That's what's depicted here. And they modify the amount of chloride going into neurons. They are described as positive allosteric modulator type drugs, and this is basically a fancy way of saying that they enhance the activity of the GABA receptor so that there is more chloride ion flux. The specific way they allow more chloride into neurons is by increasing the duration of the channel opening anytime it interacts with GABA. These drugs have a high lipid solubility, and it makes it easy for them to get into the brain, so they are very potent. They all are short to intermediate acting drugs with a short to intermediate duration of action, and because they enhance chloride flux into neurons, they have anti-seizure activity. The problem with barbiturates, and the reason you won't see these drugs used much any longer in the modern era, is because they're associated with life-threatening side effects, especially if taken in overdose. So they can cause respiratory depression. The respiratory rate can get very low, and this can lead to high carbon dioxide and life-threatening acidosis. These drugs also suppress myocardial activity, and they cause peripheral vasodilation. And so these two effects lead to life-threatening hypotension in addition to the respiratory depression and the acidosis. And so years ago, these drugs were routinely prescribed as oral sedatives for people to help them relax, but this has largely been abandoned. And one of the reasons it's been abandoned is because there were a number of celebrity deaths from patients who were taking barbiturates. In particular, Marilyn Monroe, famous actress, and Jimi Hendrix, amazing guitar player. Both of them died in accidents related to taking too much barbiturates. Especially if you take them together with alcohol, then the effects can compound one another. And so in the modern era, we don't use barbiturates much any longer, and that's because we have another class of GABA drugs called benzodiazepines, which are much safer. So that's a nice segue into benzodiazepines, which are also drugs that work on the GABA receptor like barbiturates, but they're much safer. Most of the benzodiazepines have names that end in am, like midazolam or diazepam. One exception is chlordiazepoxide, but most of the barbiturates end in am. And as I just said, they bind to GABA receptors, but they do so in a different way compared to barbiturates. That's shown in this diagram here. Barbiturates bind to one subunit of the receptor, whereas benzodiazepines bind to a different subunit. And when benzodiazepines bind, what they do is they cause the frequency of the chloride ion channel opening to increase. So this is different from barbiturates, which cause the duration of opening to increase. That's not what benzodiazepines do. They increase the frequency, and I want you to know this distinction on your step 1 exam. Because they increase activity of GABA receptors, they can suppress seizure activity, and they also have lots of uses outside of seizures. We prescribe benzodiazepines for anxiety, sleep disorder, alcohol withdrawal, all sorts of other things besides for their anti-seizure effects. Most of the benzodiazepines have long half-lives, and some of them also have active metabolites. And so for these two reasons, most benzodiazepine drugs have a long duration of action. But there are a few drugs that are short-acting. They're the 4 benzodiazepines I've listed here. Because they're short-acting, they have a rapid onset of effects, which can lead to euphoria, and this gives them more abuse potential. Patients become used to that rapid onset of a euphoric effect of taking these drugs as sedatives. Also, because they're short-acting, they have a rapid offset, and this can potentially lead to withdrawal in someone who's been taking short-acting drugs regularly for a long period of time. And the reason that withdrawal happens after chronic use is because when you take benzodiazepines chronically, your GABA receptors become downregulated. And so if you suddenly stop taking the drugs, you have a withdrawal situation where inside the central nervous system, there is limited GABA activity. And remember, GABA is inhibitory. That means that excitatory neurotransmitter activity is going to dominate. And this can lead to agitation, insomnia, or restlessness. It can even sometimes precipitate seizures. So even though benzodiazepines are anticonvulsants used to treat seizures, you also should know that they can cause seizures in a setting of someone who's been taking them for a long period of time who enters into a withdrawal state. Another thing to know about benzodiazepines is that they're metabolized in the liver, and many of these drugs go through what's called hepatic phase 1 oxidation, which is a type of drug metabolism I talk about in detail in videos in the pharmacology section. It involves cytochrome P450 enzymes, and it produces active metabolites. And those active metabolites can accumulate in patients with liver dysfunction, and this can lead to excess sedation. So using benzos in patients who have chronic liver disease or advanced liver disease can lead to excessive effects. There are, however, 3 safe drugs, which you can remember by the mnemonic LOT for lorazepam, oxazepam, and temazepam. These 3 benzodiazepines do not go through phase 1 oxidation. Instead, they're metabolized a different way in the liver by a process called glucuronidation. And this process is usually preserved in advanced liver disease and cirrhosis. And so this is very important when you're treating alcohol withdrawal in someone who has advanced liver disease. You can treat alcohol withdrawal with benzodiazepines, but if someone has advanced liver disease, you want to use one of these 3 drugs because if you use other drugs, the active metabolites will build up and the patient can have excess sedation. It is possible to overdose on benzodiazepines. This will lead to cardiorespiratory depression, somewhat similar to what we talked about with barbiturates. You can see a fall in blood pressure and respiratory rate. The good thing is it's rarely fatal, so the severity of cardiorespiratory depression from benzodiazepines is much less severe compared to barbiturates, and that's why these drugs have largely replaced barbiturates, because it's very hard to overdose in a fatal way on benzodiazepines. There is a treatment for patients suffering from overdose. It's flumazenil. This drug is a benzodiazepine receptor antagonist, and it will basically decrease GABA activity in the central nervous system and reverse the cardiorespiratory depression associated with overdose. And so here's a table I made for you of all the different benzodiazepine drugs and some details about how they work. So alprazolam is a benzodiazepine often given orally for patients with anxiety. Oxazepam, you want to remember, is a short-acting benzodiazepine that can be used safely in patients with liver disease. So we sometimes use it to treat alcohol withdrawal in patients who have liver disease. Midazolam is an IV drug usually given as part of anesthesia. I talk about it in the anesthesia videos. Lorazepam is a drug that can be used for anxiety or alcohol withdrawal, but it's also the drug of choice in treating status epilepticus, which I talk about in the seizure video. Clonazepam is another benzo given for seizures and also anxiety. Diazepam is a long-acting benzodiazepine, and so that makes it very good for treating alcohol withdrawal. When patients are having withdrawal symptoms, you'd like to give them a long-acting drug that they can take once a day or less frequently that will provide relief from withdrawal symptoms over a long period of time. You can also use diazepam for anxiety and seizures. And then chlordax epoxide, one of its famous roles is treating alcohol withdrawal, and that's once again because it's a long-acting benzodiazepine. Thing to know, though, is that this isn't one of the drugs you want to use in someone who has advanced liver disease because it does have active metabolites that will accumulate. Okay, moving on. Next, let's talk about levetiracetam, which is an anti-seizure medication whose exact mechanism is unknown. But what is known about this drug is that it binds to SV2A, which is synaptic vesicle protein 2A. This is a glycoprotein found on the surface of synaptic vesicles within neurons. So recall that inside of neurons, you have small membrane-bound structures called vesicles, and they contain neurotransmitters. When the neuron depolarizes, these vesicles dump their neurotransmitters into the synapse. And so somehow, by binding to SV2A, levetiracetam decreases neuronal firing, although exactly how this works is unclear. And through this mechanism, this drug is useful for many types of seizures, It's very popular. It goes by the trade name Keppra, and that's because it has few drug interactions. You can monitor the blood levels to make sure the patient is within the therapeutic range. And usually patients are started on this drug and then the dose is titrated until you get a high enough blood level and you achieve the desired clinical effect. In terms of adverse effects, levetiracetam can depress central nervous system function, so this can lead to nonspecific things like drowsiness, fatigue, dizziness, and you can see all these features with many anti-seizure drugs. It's one sort of special or unique adverse effect that you want to remember is that it can cause psychiatric problems. So in some patients, for reasons that are incompletely understood, it triggers irritability and mood changes and sometimes agitation. It's been reported to sometimes exacerbate aggression or suicidal thoughts. And in rare cases, it's been reported that it can cause psychosis. So most of these side effects are relatively infrequent, but this is the special group of side effects you want to remember for this drug. Okay, moving on, our next group of drugs are the gabapentinoids. There are two important drugs in this class, gabapentin and pregabalin. And these drugs are called gabapentinoids because structurally they are analogs of GABA, gamma-aminobutyric acid, that inhibitory neurotransmitter we talked about earlier in this video. So these drugs were designed thinking that they would bind to the GABA receptor. However, it turns out they actually don't bind GABA receptors, even though they're called gabapentinoids. What they actually do is they block calcium channels in neurons, and this is the mechanism responsible for their central nervous system effects. In terms of adverse effects, these drugs can depress the central nervous system, so they can cause drowsiness, dizziness, fatigue. Some patients develop ataxia and loss of coordination. Some patients also report memory problems. And then beyond this, you should know these drugs are associated with weight gain. They stimulate the appetite. Also, because they cause sedation, patients don't get as much activity, so they don't burn as many calories. And so both of these effects conspire to cause a lot of weight gain in patients who take these drugs chronically. You should be aware that gabapentinoids have lots of uses outside of seizures, and one of the biggest ones is for so-called neuropathic pain syndromes. These are pain syndromes that involve lots of inflammation or dysfunction of nerves. One of the big ones is postherpetic neuralgia, which is a pain syndrome that can develop after shingles. So if someone gets shingles and has this rash, sometimes the rash resolves, but the patient has lots of neuropathic pain in the affected dermatome. Gabapentinoids like gabapentin are used to treat that. Same thing with diabetic neuropathy. Some patients have very painful feet and ankles and legs from diabetic neuropathy, and gabapentinoids can be used to treat that. These drugs are also sometimes used to treat fibromyalgia and anxiety. They can also be used to treat alcohol withdrawal. Okay, our next anticonvulsant drug is lamotrigine. This drug inactivates sodium channels, and besides being used to treat seizure disorders, it's also often used to treat bipolar disorder. It has many of the typical central nervous system adverse effects associated with anti-seizure drugs, things like sedation, dizziness, and fatigue. It also has a special skin effect, which is that in up to 10% of patients in some series, it causes a maculopapular rash. And so if you remember this, then it's easy to remember that besides a sort of benign itchy maculopapular rash, it can also cause more serious skin problems like Stevens-Johnson syndrome. In particular, there have been case reports of this drug reaction in children, and also DRESS, which I talk about in other videos. Okay, our next anticonvulsant drug is topiramate, which has a couple of effects that are beneficial in seizure disorders. First of all, it's a sodium channel antagonist, but in addition, it enhances GABA receptor activity in the central nervous system. Besides being used for seizures, topiramate is also used to treat migraine headache, which I talk about in another video. And one of its effects that's often beneficial for patients is that it causes weight loss, suppresses the appetite, and so patients who are a little bit overweight or who want to lose weight often like being on this drug for this reason. There are three important side effects of topiramate that you need to remember, and they're all listed on this slide. So first of all, it has central nervous system suppressing effects. It can make patients feel sedated and mentally dull. Patients often say they feel foggy or dopey, and because of this, some people call this drug Dopamax. Its trade name is Topamax, so the Dopamax is to remind you that it makes patients feel dopey. It also can cause paresthesias. Patients can report tingling or numbness, especially in their fingers or toes. And then lastly, this is super high yield for board exams. It can cause kidney stones. Why does it do this? It's because this drug is a weak carbonic anhydrase inhibitor, just like carbonic anhydrase inhibitor diuretics that I talk about in the renal section. So by inhibiting the enzyme carbonic anhydrase, it makes the urine alkaline, and that is a favorable environment for calcium phosphate stones to form. So many patients who take this drug develop kidney stones through this mechanism right here. Okay, and then I'll finish this video with one slide on primidone. This is a drug that is metabolized in the body to become phenobarbital and have effects similar to the barbiturate phenobarbital. It's rarely used any longer as an anti-seizure medication. Its main use is that it's the first-line therapy for essential tremor, which is a movement condition that I talk about in other videos. And that concludes our second module on anticonvulsants.